Hello everybody, how are you? I know we're doing fine. We remain in therapy that is always there to make you happy, always there to give you information that will actually help you. Right, today we'll be treating the 7 symptoms of pregnancy. You know, there are a lot of symptoms that comes in different way, especially in different unique women. Not what you observe this month is still what you're going to observe in the next year or any time you wish to take it. So we have to enlighten you more on certain symptoms or certain signs you can actually see in your body, and it will indicate that you're having issues or you're already pregnant. Do you understand? Not issue per se, that you already have a game-changing condition, which is pregnancy. So today we're going to talk about it. So we have about 7 symptoms here. We have about missed period. Missed period comes in when you are, yes, we'll talk about this. Missed period comes in especially for women who are in their regular period or cycle. So missed period is something you get your menstrual cycle. All right, the next thing you feel is nausea and vomiting. Yes, nausea and vomiting comes up once you miss your menses, and it can actually come up at every given time. I actually start seeing it in the first 7 days you actually observe the conception process in your system. 7th days that you started actually having that, or 2 weeks of this very conception, is very significant that you can actually start observing it. So one thing you have to see that shows that you are already in there is vomiting and nausea. So once you start seeing it at any day, it indicates that you already classically seeing the symptoms of pregnancy in your body. All right, the next thing is fatigue. Fatigue can actually come as a common condition during early pregnancy at a particular time for hormonal changes that has already set in. So fatigue comes in, the hormones fluctuate. Do you understand? Because there are changes in the system. Gonadotropic hormone, the chronic gonadotropic hormone has already started stimulating in the system, and that alone will start bringing fatigue in your system. A lot of changes in the system and under hormones that has already set in. So this can actually be observed as symptom of pregnancy in your system. Then we'll talk about the breast tenderness that is observed as well. Breast tenderness is being observed as a result of the stimulations of hormone prolactin that is in the system. So you can actually, yes, we'll talk about the breast tenderness again. So breast tenderness can actually come as a result of hormonal fluctuation that can bring tenderness and darkness in the nipples of the breast during this very period. So it's actually a symptom that could be observed. So it differs from every other person. Some people have that tenderness in their breast. Some people don't feel that tenderness at that particular point, but the nipples will always give you that tenderness and give you that slight pain there due to hormonal fluctuation. So we'll talk about frequent urination. Frequent urination is something that you can actually observe because of the pressure that is down there in the bladder. As I said, frequent urination is being observed as can actually, because of that very pressure in the uterus, it can actually bring from that extension that uterus is actually having at a particular time that the pregnancy is actually extending. It can actually lead to you having a lot of pressures on the bladder, and then leading to every time getting a trip to the toilet so that you'll be able to urinate. Another thing you can actually observe is mood swing. Mood swing can actually come as a result of hormone changes. You know, these hormones that can actually bring mood swing, irritability, or actually emotional ups and downs that can actually come, you thinking what is going on in your system that you don't actually understand. You want to actually get it, that you don't understand, like you don't actually know what to think at a particular time, just knowing that the hormone is actually bringing that mood swing to you. So we'll talk about food aversion or crafting. Do you understand? When we talk about the cravings of food that comes up in different women, some women experience strong cravings for certain foods or that smell that is actually attached to it, while others might develop some adhesions to food that has previously been enjoyed. See people saying that they don't want to take this, know that they are perceiving some level of some level of spices in it that they don't want it. There's this what's it called, this Igbo pay that is in it that no, we don't like this, no, I don't want to eat it again, pepper is much, this is there, it's too salty, it's too this. So you see a lot of things coming up. You see yourself when you're being given something, or when when you're being served with something that you used to love before, you find out that you're no longer interested in it. Rather, you might be going for things that you've actually rejected all those while. That is what you'll be craving for. So all the same, we'll talk about all this, and the key thing is for us to understand that all the symptoms are so different.